Hello, and welcome to Wise Elder Voices, where the wisdom of age meets critical health insights to keep you thriving. I'm your host, bringing you knowledge from years of experience, here to guide you through the challenges of aging with clarity and care. Today, we're addressing a vital topic that could save your life: 5 sudden death triggers in the elderly you must know to protect your health. Hooked to a startling reality, did you know that after 65, heart-related sudden deaths account for nearly 25% of all fatalities in seniors? Sudden death triggers can strike without warning, but understanding them can empower you to protect your health. Backed by research, we'll explore 5 major risks and offer practical steps to avoid them. Whether you're over 65 or caring for a loved one, this video is for you. So settle in with an open mind and let's learn how to safeguard your future. Let's get started. The first sudden death trigger in the elderly you must know to protect your health is sudden cardiac death, SCD, from heart disease, a silent and often fatal event that can strike without warning, especially after 65. Heart disease, including conditions like heart attacks and arrhythmias, is the leading cause of death among seniors, accounting for nearly 25% of fatalities in this age group, according to the Centers for Disease Control and Prevention, CDC. Imagine a moment where your heart suddenly stops beating effectively, chest pain, shortness of breath, or even no symptoms at all, and within minutes, life can slip away. This is the reality of sudden cardiac death, and understanding it can be your first step to prevention. Sudden cardiac death often stems from underlying heart disease, particularly coronary artery disease and congestive heart failure, which become more prevalent with age. The Nature Reviews Cardiology Journal explains that the incidence of SCD increases in the elderly due to a higher prevalence of these conditions, with degenerative heart changes making the heart more vulnerable to fatal arrhythmias, abnormal heart rhythms that can stop blood flow instantly. The American Heart Association, AHA, adds that over 80% of seniors over 75 have some form of cardiovascular issue, with risk factors like high blood pressure, high cholesterol, and smoking amplifying the danger. Symptoms might include chest pain, dizziness, or fainting, but many experience no warning signs, making prevention critical. The National Institute on Aging, NIA, warns that seniors often dismiss subtle signs like fatigue as normal aging, a mistake that can lead to sudden fatal events. Let's meet Evelyn, a 68-year-old who narrowly escaped this trigger. "I felt dizzy one morning, but ignored it," she shares, her voice tinged with gratitude. "Later I collapsed. It was a heart arrhythmia. My doctor said I was lucky to survive. I started managing my blood pressure, eating better, and taking my meds. Now, I feel stronger." Evelyn's story reflects a common reality. Sudden cardiac death can strike unexpectedly, but proactive steps can save lives. The AHA recommends controlling blood pressure below 120/80 mmHg with a diet low in sodium, think leafy greens and berries, and regular exercise like 150 minutes of walking weekly, as the NIA suggests. Quit smoking, as it doubles the risk of SCD, and manage cholesterol with statins if prescribed, per medical guidelines. Prevention also involves regular checkups. Monitor your heart rhythm and blood pressure annually, as the CDC advises, to catch issues early. If you have a history of heart disease, talk to your doctor about devices like implantable cardioverter defibrillators, ICDs, which can prevent SCD by correcting dangerous rhythms, as Nature Reviews Cardiology notes. Stay active. Chair yoga or swimming can improve circulation without strain, per the NIA. Critically, this challenges the narrative that heart disease is inevitable with age. While risk rises, your choices can defy the odds. Imagine living past 80 with a strong heart, enjoying every moment with loved ones. This is your first step to avoiding sudden cardiac death. Prioritize your heart health and live with confidence. The second sudden death trigger in the elderly you must know to protect your health is stroke, a devastating event where blood flow to the brain is interrupted, often leading to rapid fatality if not addressed immediately. Stroke accounts for about 10% of deaths in seniors over 65, according to the CDC, with the risk doubling each decade after 55, as the American Heart Association (AHA) notes. Imagine a moment where you suddenly can't speak, one side of your body goes numb, or your vision blurs. A stroke can strike in seconds, and without swift action, it can be fatal. After 65, understanding this risk can empower you to take preventive steps and protect your brain health. Strokes come in two main forms: ischemic, where a clot blocks blood flow to the brain, and hemorrhagic, where a blood vessel bursts, both of which can lead to sudden death if severe. The AHA highlights that over 75% of strokes occur in those over 65, driven by age-related changes like stiffened arteries, high blood pressure, and conditions such as atrial fibrillation, a heart rhythm disorder common in seniors that increases clot formation risk. The National Institute on Aging (NIA) warns that symptoms like sudden confusion, trouble walking, or severe headache are often mistaken for fatigue or aging, delaying critical care. The CDC emphasizes that acting within 3 hours can save brain tissue, but many seniors don't recognize the signs, making education and prevention vital. Let's meet Harold, a 72-year-old who survived a close call with stroke. "I felt a sudden weakness in my arm and couldn't speak clearly," he shares, his voice steady with relief. "I thought it was nothing, but my wife called 911. It was a stroke. I got treatment in time, and now I manage my blood pressure and exercise daily." Harold's story underscores the importance of quick action and prevention. The AHA recommends keeping blood pressure below 120/80 mmHg with a diet rich in potassium. Think bananas and sweet potatoes, and regular exercise like 150 minutes of moderate activity weekly, such as swimming, as the NIA suggests. Quit smoking, as it doubles stroke risk, and limit alcohol to 1 drink daily per WHO guidelines. Manage diabetes and cholesterol, as both increase clot risk per the CDC. Prevention also involves knowing the signs. Use the FAST acronym: face drooping, arm weakness, speech difficulty, time to call 911, as the AHA advises. Regular checkups to monitor heart rhythm and blood pressure can catch risks early, and if prescribed, take medications like blood thinners to prevent clots, as medical guidelines recommend. Stay active. Chair yoga or walking improves circulation, per the NIA. Critically, this challenges the narrative that strokes are inevitable with age. While risk rises, your choices can reduce it significantly. Imagine celebrating your 80th birthday with a sharp mind, free from the fear of stroke. This is your second step to avoiding sudden death. Protect your brain and live with clarity. The third sudden death trigger in the elderly you must know to protect your health is severe falls, a seemingly minor event that can lead to fatal outcomes, especially after 65. Falls are a leading cause of injury and death among seniors, with the CDC reporting that 1 in 4 Americans over 65 falls each year, and over 14,000 of these falls result in death due to complications like head injuries or hip fractures. Imagine stepping on an uneven sidewalk, losing your balance, and hitting your head. A fall can happen in an instant, and for the elderly, the consequences can be deadly. Understanding this risk can empower you to take steps to stay safe and independent. Severe falls often lead to sudden death through complications like traumatic brain injury, TBI, or hip fractures, which can cause fatal infections or blood clots if mobility is impaired. The National Institute on Aging (NIA) notes that after 65, muscle mass and balance decline, increasing fall risk, especially if you have conditions like osteoporosis, affecting over 10 million Americans over 50 per the CDC. Vision impairment, slower reflexes, and medication side effects, like those causing dizziness, further heighten the danger, as Griswold Care highlights. A fall can trigger a cascade of issues. A hip fracture might lead to surgery, immobility, and then pneumonia, a common cause of death in seniors, as a place for mom points out. The CDC warns that seniors often underestimate fall risk, assuming it won't happen to them. A mindset that delays prevention. Let's meet Clara, a 70-year-old who learned this lesson the hard way. I slipped on a wet floor and broke my hip, she shares, her voice tinged with gratitude. I was in the hospital for weeks, developed an infection, and nearly didn't make it. Now I use a cane, do balance exercises, and keep my home safer. Clara's story reflects a common reality. Falls can lead to sudden death, but prevention can save lives. The NIA recommends balance exercises, like standing on one leg for 10 seconds, using a chair for support, to improve stability. Aim for 5 minutes daily, as Silver Sneakers suggests. Keep eyeglass prescriptions updated to improve vision. Wear rubber-soled shoes for traction, and remove tripping hazards like loose rugs, as Griswold Care advises. Regular checkups to review medications can reduce dizziness risks, per the CDC. Prevention also involves staying active. Chair yoga or Tai Chi strengthens muscles and improves coordination, reducing fall risk by 23%, per the National Council on Aging. Install grab bars in bathrooms and ensure good lighting, as a place for mom suggests, to minimize hazards. Critically, this challenges the narrative that falls are a normal part of aging. While risk increases, proactive steps can defy the odds. Imagine walking confidently at 80, free from the fear of falling. This is your third step to avoiding sudden death. Prioritize balance and safety, and live with independence. The fourth sudden death trigger in the elderly you must know to protect your health is respiratory infections, like pneumonia, which can escalate rapidly and become fatal, especially after 65. Pneumonia and other respiratory infections contribute to about 6% of deaths in this age group, according to the CDC, with the risk surging as lung function and immunity decline with age. Imagine a cough that won't go away, a fever spiking and breathing becoming a struggle. A respiratory infection can strike quickly, and for seniors it can be deadly. Understanding this risk can empower you to take preventive steps and protect your lungs. Respiratory infections, particularly pneumonia, are a major concern for the elderly because aging weakens the lungs and immune system, making infections more severe. The National Institute on Aging (NIA) warns that seniors over 65 are at higher risk for pneumonia due to reduced lung capacity and slower immune responses, a risk compounded by chronic conditions like COPD, which affects over 15 million Americans, per the CDC. Symptoms like fever, cough, shortness of breath, or confusion are often dismissed as a cold, delaying treatment, a critical mistake, as Griswold Care notes that pneumonia can lead to sepsis or respiratory failure in seniors. The CDC emphasizes that older adults are more likely to die from infectious diseases like pneumonia, a leading cause of death in this group, especially if untreated. Let's meet Robert, a 74-year-old who narrowly escaped this trigger. I had a bad cough and felt feverish, he shares, his voice steady with relief. I thought it was just a cold, but it got worse fast. I couldn't breathe well. My doctor said it was pneumonia and got me antibiotics in time. Now I get my flu and pneumonia shots every year. Robert's story reflects a common reality. Respiratory infections can escalate to sudden death, but prevention can save lives. The NIA recommends annual flu and pneumonia vaccines to reduce infection risk. Vaccines can lower pneumonia mortality by 30%, per the CDC. Avoid smoking, as it damages lung tissue, doubling infection risk, and stay active with exercises like walking to strengthen respiratory muscles, as the AHA advises. Prevention also involves good hygiene. Wash your hands regularly and avoid sick contacts, especially during flu season, as Griswold Care suggests. Eat an anti-inflammatory diet with foods like fish and berries to support lung health, per the NIA. If you have symptoms like fever or shortness of breath, seek medical care immediately. Early antibiotics can be life-saving, per the CDC. Critically, this challenges the narrative that infections are unavoidable with age. While risk rises, your actions can lower it. Imagine breathing easily at 80, your lungs strong and clear. This is your fourth step to avoiding sudden death. Protect your lungs and live with vitality. The fifth sudden death trigger in the elderly you must know to protect your health is suicide due to isolation, a heartbreaking yet often overlooked risk that can lead to sudden preventable loss after 65. Suicide accounts for nearly 1 in 5 suicides in America among those over 65, according to NPR, with loneliness and isolation driving many to this desperate act. Imagine feeling so alone that life no longer seems worth living, a silent struggle that can end in sudden death if not addressed. Understanding this risk can empower you to take steps to protect your mental health and stay connected. Isolation is a pervasive issue for seniors, often triggered by the loss of a spouse, friends, or mobility, which can lead to profound loneliness, a major risk factor for suicide. NPR highlights that seniors who attempt suicide have a higher fatality rate, with 1 in 4 attempts succeeding compared to 1 in 200 for younger adults, due to frailty, isolation, and more deliberate planning. The National Institute on Aging (NIA) warns that bereavement, common in seniors, can trigger major depression and complicated grief, with over 30% of those over 65 experiencing depression, per the CDC. Symptoms like withdrawal, loss of interest in activities, or talk of feeling like a burden are often missed, as NPR notes that research on elderly suicide is scant, leaving loved ones unaware of warning signs. Let's meet Margaret, a 69-year-old who found hope after battling isolation. "I lost my husband and felt so alone," she shares, her voice soft with emotion. "I stopped seeing friends and I thought about ending it. My daughter noticed and got me help. I joined a senior group, started therapy, and now I feel connected again." Margaret's story reflects a harsh reality. Isolation can lead to sudden death by suicide, but support can save lives. The NIA recommends staying socially active. Join a senior center or book club to build connections, reducing loneliness by 20%, per studies. Seek mental health support. Therapy or counseling can address depression, and the National Suicide Prevention Lifeline, 1-800-273-8255, offers immediate help, as NPR advises. Prevention also involves building a support network. Schedule weekly calls with family or friends, as NPR suggests, to combat isolation. Stay active. Exercise like walking or yoga boosts endorphins, improving mood, per the AHA. Share your feelings. Talk to a trusted loved one if you feel overwhelmed, as the NIA encourages. Critically, this challenges the narrative that loneliness is a normal part of aging. It's a risk factor, but one you can overcome with connection and care. Imagine thriving at 80, surrounded by loved ones, your heart full of hope. This is your fifth step to avoiding sudden death. Nurture your connections and live with purpose. And there you have it. 5 sudden death triggers in the elderly, from sudden cardiac death to suicide due to isolation, and practical steps to protect your health. These risks may loom large, but your actions can keep them at bay. If this video has empowered you to safeguard your well-being, please give it a thumbs up. It helps us reach more seniors like you. Share it with friends and loved ones to spread this life-saving knowledge. Subscribe to Wise Elder Voices for more senior health insights, and hit the bell to stay updated. Stay safe. Stay connected. Your healthiest years are ahead. See you next time.